Sports is back. The NHL and NBA are putting players in a quarantined environment, but the MLB is not. The St. Louis Cardinals and Miami Marlins are both dealing with recent outbreaks of COVID-19. And many of you are asking how professional sports is handling COVID-19 in this pandemic. Every week we get your coronavirus questions answered during a special segment called Q&A with Dr. Dave. So joining us now is CBS 4 medical editor Dr. Dave Hnida. Dr. Dave, it's great to see you.
Good to see you too.
Thank you so much for joining us. So tell me, what do you think of these different approaches that these professional sports leagues are taking?
Well, they're all in a different situation, different scenarios, so they've got to come up with the best they can. I think right now the gold standard is really the bubble concept that's being used, for example, by the NBA. NBA is literally kind of on an island, and on that island, you can't leave it. You cannot come back onto it unless you wind up quarantining. And they've done a very good job in terms of keeping players healthy. They just recently tested 340 some players and all wound up testing negative. But if you look around at other teams, other leagues, NHL doing the same thing, WNBA, same thing, Major League Soccer, same thing. So the bubble concept is a very good concept. And then you leave the bubble concept and you go to Major League Baseball, totally different situation, which literally is a minute by minute, what's going on, what's going to happen with baseball. Take a look at somebody who's playing for the Rockies, for example. They get up, they're home, they go to the ballpark after being with their family or friends during the course of the game. And their time in the stadium to the time they leave, they come in contact with at least 60 other people, and those 60 have obviously had contacts with others. So there's an awful lot of personal responsibility there in terms of behavior. And then you take a look at what happens when they go on the road. With the way the geographic setup is, the Rockies wind up traveling to places like Oakland, San Francisco, Los Angeles, Arizona, Texas. So not exactly the optimum places to go and play games. And then you move to football. What's going to happen with football? I think that is just $1 million question right now, because NFL is really trying to be very proactive, actually more from a technological standpoint. They're trying to develop masks and certain face guards and equipment in order to minimize the chances of having their players come in contact with COVID. But just by the very nature of the game, whether it be on the field or off the field, they're going to have some struggles in terms of keeping a COVID-free environment. And then last but not least, what's going to happen with college football, one of my favorite times of the year. You know, there are more than 130 Division I major college football teams. And what you do is you take a bunch of areas that are hotspots, you take a look at college campuses, and then you throw into the equation the fact that you have teenagers and 20-year-olds in there. And that's not a good recipe for keeping COVID out of the equation and the experience. And already there have been teams who have tried summer workouts and had to cancel those summer workouts or postpone them, including Colorado State, because of COVID breakouts. And so, you know, I think right now, being fluid is going to be a big thing, but I would not keep expectations super high in a non-bubble situation.
And what do you think about fans in the stands? You think people will be able to show up if we do have a football season, for example?
I know the Broncos are trying to figure out how exactly they're going to maybe socially distance in a fan situation, but to tell you the truth, I'm not so sure I'd be very comfortable attending a game at this point in time. Things are going to change over the course of days and weeks, and I think right now it's much too early to say exactly what the situation is going to be at the beginning of the season.
It's a really good point you're making. I think we're in such a dynamic time. It's really hard to predict. I think one thing that we do know is that wearing a mask does protect other people. You know, just last week, though, we had a couple of reports that came out that suggest that there could be more to this theory, that having someone wear a mask might also protect the person wearing the mask. Can you talk a little about this?
Yeah, it's really good stuff. When you think about it, the idea has always been you wear a mask so that you protect others from yourself. But these studies took a look at things on an international scale and what's gone on over the past several months. And kind of the good news to come out of it is the fact that they also found that not only did people who wear masks wind up not spreading any potential virus, but it also protected them as well. With the thinking being that just having fabric over your face, if you come in contact with someone who does have COVID, you will wind up having at least some filtration of virus particles. And so you'll either get fewer particles or no particles inside of your airways. So the chances of getting severe disease wind up going down. The chances of no disease actually wind up going down. So it's really kind of a good thing. Big or real quick reminder for folks too. Remember, if you are going to wear a mask, number one, thank you. Number two, please be sure to wear it above your nose.
That's a great point. We actually see that numerous times, even in interviews with people. The mask slips down. It's a good reminder to just bring it up over the nose. That's when it really works, correct?
Correct.
Okay, we recently learned that LabCorp is going to start doing pooled coronavirus testing. And I'm wondering, okay, LabCorp is the company that does the testing at the Pepsi Center. So what does this pooled testing look like, and what does that mean for us? Why is it necessary?
Actually, pool testing is something that's been around for, 60 years. And it actually is something that really can come in handy at a time like this. If you take a look at places like LabCorp and Quest, they're commercial labs. And what's happening is they are just simply being bombarded and overloaded with testing, and not necessarily from Colorado, but these are national companies. And so they're getting overloaded from every state around the country and just really unable to do good testing turnaround. So what good is it if you go and you have a COVID test and you don't get the results back for 5, 7, 10 days? By that time, really knowing one way or the other is really not very helpful. So what you do is you do something called pooled testing. What that means is you get a group of people, let's say anywhere from 4 to 10. Get 10 swabs, 10 different samples from people, and you put them all together into one batch, and then you test that batch. And if it lights up positive, then what you do is you have to go back and you test each sample individually. But for the most part, what you're hoping for is all of those samples, or the one sample you've tested to be negative. So you don't have to go and then individually test specimens from all the other people. It winds up saving time, it saves equipment, and it saves the use of chemicals that are used to process the test. So the turnaround times become much more quickly. It's going to be helpful for Colorado because our case counts are not as bad and our positivity rate is not as high as other states. It is not really a very good thing to use if you have a COVID hotspot, because it's almost every pool test you do is going to wind up lining up positive. You're going to wind up doing more tests than you had originally planned. It's also something that's not good in terms of certain healthcare facilities, long-term care facilities, and other types of situations. But for the most part, if you take a look at Colorado's unique situation, at least where we are right now, it is something that is going to help speed up testing results and having a better idea of where you are.
Dr. Dave, thank you. That is so fascinating. We do appreciate you enlightening us today.
It was good to be with you.
All righty. And of course, Dr. Dave will join us here next Monday at 11 in the morning as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, visit cbsdenver.com.